The Jamaica Anti-Doping Commission presents Jadco and You.
I'm Dr. Wint.
I'm Darren.
Darren, how may I help you today?
Alright, well, Doc, lately I've been feeling very weak, and throughout the day I'm using the bathroom more than regular, and I'm feeling very thirsty.
Well, when you have these three symptoms, we normally think about high blood sugars. Okay, Darren, based on what I'm seeing from the results, it indicates that you're in the early phase of diabetes. Your type of diabetes is diabetes type 1. So what that means is that the organ called the pancreas, which normally puts out insulin, which is what normally controls the blood sugar, is becoming deficient. So what we're going to do is replace that same insulin that the pancreas would normally put out.
Alright, well, hold on. I said that insulin is one of the prohibited substances on this list, right? And I'm a professional athlete, so what do I do?
Okay, so what you'll have to do, considering that it is a prohibited substance, is that you'll have to apply to Jamaica Anti-Doping Commission for a therapeutic use exemption. When you go with this, you'll have to go with the test results, which will confirm that you do have diabetes type 1 and that you need to take insulin.
Athletes may have legitimate illnesses or conditions that require them to take particular medications. If the medication an athlete is required to take to treat an illness or condition happens to fall on the list of prohibited substances and methods, a Therapeutic Use Exemption TUE must be obtained. A TUE is necessary before an athlete uses a prescribed prohibited substance or method for the treatment of a legitimate medical condition. All signatories of the World Anti-Doping Program must adhere to the 5 international standards. The international standards are the technical and operational standards for the anti-doping program, and the therapeutic use exemption is among them. We will now examine the steps involved in the process when an athlete applies for a therapeutic use exemption.
A therapeutic use exemption is basically a medical certificate that gives an athlete permission to use a banned substance for a diagnosed medical condition that he has. The individuals that determine whether an athlete is able to use a banned substance and grant a therapeutic use exemption involves a panel of medical doctors. Most of them are specialists, which will review the athlete's application and determine if the prescribed medication is appropriate for the diagnosed condition that the athlete has. To apply for a therapeutic use exemption, the athlete first needs to obtain an application form, and this is usually available from Jadco, either on their website or from the Jadco office. Once the form is obtained, it is completed by the athlete in conjunction with the treating medical physician, who must include on the form the diagnosis and also the particular drug that is prescribed to treat the condition. Once an application is submitted to Jadco, it is presented to the Therapeutic Use Exemption Committee, who will then review the evidence, and usually within 21 days, a decision is made to grant the therapeutic use exemption.
Apply for your TUE at least 21 days prior to taking part at an event. Only in exceptional cases can a TUE be granted retroactively. Comply with the treatment conditions outlined. Declare the approved medication on the doping control form while being tested. Keep a copy of your TUE certificate handy. TUEs do expire, so be vigilant and ensure it is renewed. The Jamaica Anti-Doping Commission, committed to the fight against doping in sport. For more information, contact Jadco's office at 529 South Oden Avenue, Kingston 10. Telephone 929-3500 or log on to www.jadco.gov.jm. Feel free to also visit their Facebook, Instagram, YouTube or Twitter pages. Jadco and You was brought to you by the Jamaica Anti-Doping Commission.